Let's have a look at what could be precipitating acute heart failure or what could be leading to acute exacerbation of heart failure. Hi everyone, I want to talk about heart failure acute exacerbation. I've just published heart failure decompensation. So if we go over that, we need to know why we can run into trouble pretty quickly. So let's go. What are the precipitants of acute exacerbation in heart failure? The precipitants could be new myocardial infarction. The fact that this individual is diagnosed with heart failure doesn't mean the only problem the person will be having is heart failure. No. And in fact, what is even causing the heart failure? And the fact that a particular etiology has been identified as the cause of this heart failure right now doesn't mean the individual is immune to other medical problems. Okay, so the fact that we've not diagnosed myocardial infarction in this individual before now doesn't mean the individual cannot come down with myocardial infarction right now. So the precipitants that I'm going to go over could be something new entirely, or they've been there but now getting worse. Okay, new myocardial infarction, and we know what to do CKMB, troponin, and so on. Is this arrhythmia? Arrhythmia could be responsible. EKG will pick that. Valvular heart disease, I'm going to pick that with echo. Is this new hypertension? Maybe this individual has not been diagnosed with hypertension before. It's now coming down with this, so it could serve as a precipitant. Any anemia, maybe bleeding or inadequate intake, any thyrotoxicosis right now that was not there before. Is this person affected with infection right now? That's why I want to take the temperature, but don't be fooled. Temperature in elderly might not give a clearer picture because sometimes in elderly people, they will not have high temperature or not be too low, yet they are infected. And that is why most elderly people will quietly die of pneumonia or renal infection without proper diagnosis because the fever may not be there. Newly diabetes mellitus might be, it's not just been diagnosed, but it's there now, could be a precipitant. New problem with medications by failing to take meds. Yes, could be the cause of this acute exacerbation. New problem with increased salt intake. There was a case of a friend who joked about it that the dad was diagnosed with heart-related issue and was told not to be taking salt, and she would sneak in and add salt to the food of the dad. What a lovely relationship between a father and a daughter. But that could actually lead to precipitation of the heart failure. New problem with obstructive sleep apnea. Okay, new diagnosis, rheumatic heart disease, failure to exercise, that is, if they can tolerate it. I will not place anybody on regular exercise without first of all carrying out exercise stress tests. Diagnose renal disease that is new, and of course liver pathology that is now here but was not here before. And of course, newly diagnosed toxin, street drugs, and alcohol. So if all these things are coming for the first time, no awareness before, they might be the culprits here for this acute exacerbation. So when somebody is on medication for heart failure and suddenly the situation is getting worse with him or her, look for all these causes and even more. Okay, the next presentation will be on drugs to be cautious with when it comes to people with heart failure. Thanks for listening. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thank you.